And the reason was they wanted to fundraise, I think back in the days, 3 million Indian rupees.
So you could have picked any other segments, right?
So the idea was through Milaap
Hmm.
and through the power of crowdfunding. 2013 Uttarakhand floods, a lot of people came to us, but that was actually a trigger point for us to start thinking.
How do I ensure that the funds that have been raised is for the valid cause, going to the right beneficiary?
So we probably are connected with over 90% of the tertiary care hospitals.
So I'd like to know why United States is your second most destination that you chose.
So we receive donations from 130 countries.
Namaskar. Welcome to Passionate Pulse podcast. Today I have a wonderful entrepreneur who is making amazing social impact for almost 12 years. He's been to drive the community impact through his startup, and it's one of the great technical portal that we see today in India. It's known as Milaap. I'd like to welcome Milaap's founder, Mayukh Chaudhary.
Thank you very much. Thanks a lot, Pranali, for having me on Passionate Pulse.
Yeah, it's wonderful to have you, and especially when we look at the social impact driven startups. So I kind of go and have a lot of talks with a lot of entrepreneurs, and looking at the Silicon Valley, we have a variety and a huge range of entrepreneurs solving niche problems.
Sure.
So what really made you at a very young age to literally drive into social impact cause versus making money, considering you are being IIT and IIM, not running behind the paychecks and
It's a great question and a lot of kind words. A lot of you have said. So I think in terms of getting started on Milaap, and this is back in 2012, 2010 to 2012, when Anuj and I kind of thought about Milaap.
Mm-hmm.
And I can say it was more about a phase of life.
Okay.
So there are a lot of entrepreneurial stories. Since you interact with a lot of people, you would have heard that they are, a certain incident drove them to starting a company, or gave them the inspiration. For us, it was that phase of life, and the juncture at which we both met is I had quit my job in Dubai. I was a consultant. That's how I started my career. I wanted to get closer to the hinterlands, experience, what's going on, business models out there. So I was there trying to, work on affordable solar lanterns, agri financing. Anuj at that point of time took a sabbatical from National University of Singapore.
Okay.
Inspired by microfinance. And he was also in that similar phase. And that's where the two of us connected.
Okay.
Over a period of a couple of years, the inspiration came in, and the idea came in, let's get things going and see how it goes.
But in microfinance, you could have done many other things, right?
Yeah, it's just that, we wanted to do something which was, microfinance was already becoming mainstream by then, back in India. We had public markets coming in the space and all of it. We thought that there are ways to expand the scope, and we were inspired by technology. So it's like a intersection of technology, financing at the grassroots, as well as creating a social impact in terms of all these three coming in together. And that's where Milaap's inspiration came in. It took us a while to figure out where crowdfunding would be fitting into the lives of everyday individuals in India. And that came to us around 2014-15.
Okay.
When we started seeing, and when we opened up the platform, we said, we have built something. Let us just see how people use the platform. And interestingly, at that point of time is when we realized healthcare and medical emergencies are one of the major reasons why people could use Milaap, and has shaped Milaap ever since.
So were there like a lot of inspirations came from GoFundMe? Have you studied GoFundMe at that time? Because GoFundMe was there by then, it was existing, but it was just not catering to India and other countries in Asia specifically.
Very interesting story that you have asked. So let me take you back to 2012-13. The crowdfunding space at that point of time is dominated by stories around Kickstarter, because that's what everybody was fascinated about. It was amazing to see that. 2014 is the time when we started seeing a few of the healthcare fundraisers come in. You talk of examples. I'll tell you what made us think that, what's exactly healthcare all about. We saw fundraising campaigns set up by a few young people from Bombay.
Okay.
And the reason was they wanted to fundraise, I think back in the days, 3 million Indian rupees, 30 lakh as we say.
That's a big amount.
Yes, for the heart transplant of their friends.
Okay.
And we were surprised as a team because we were working on various causes and education to microfinance to everything we are trying to support via crowdfunding. And we were pretty surprised to see the somebody trying to fundraise for a heart transplant.
Uh-huh.
So I still remember we had a discussion in the team, like what exactly is this fundraiser? What should we do? And the consensus was, if people want to do something and help each other, let them do it. 7 days. At that point of time, we've never heard of crowdfunding. It just raised the money.
Wow.
The entire team is surprised. We didn't have to put an effort. The friends were doing everything. They ensured that the money is raised. And they asked us to put the money in the bank account of a hospital where eventually the transplant was successful. So it was a great success story, inspiration for us. And we started seeing this entire phase of one after the other fundraising campaigns coming in for healthcare to solve for what we today call as affordability gap.
Right.
So then we were curious what's happening in US. And I remember still, this is late 2014, completely unknown company called GoFundMe suddenly publishes a blog by saying we are the largest crowdfunding platform in the US. Look back at GoFundMe and we are like, what? This is exactly what we are seeing in India.
Right. So you had started earlier than GoFundMe actually.
Probably I think at the same time, because for GoFundMe also, I think they took some time in terms of figuring out, and then their growth was really fast since 2012. And I think almost similar point of time when crowdfunding was coming into the mainstream across the world. So in that sense, I think there was a consensus that this form of financing would kind of play a role in various ways across economies. So yeah.
But just to, if I have to think back about your microfinance and a lot of your background, you could have done the microfinancing for a lot of other entrepreneurs and a lot of other things, different sectors with the, since you were working initially with the solar energy sector could have been a prominent infrastructure that could have been improvised in India. I mean, even now, it's one of the underlooked segment and it's still not there as what should have been. So you could have picked any other segments, right?
So the idea was through Milaap and through the power of crowdfunding, we would try to promote such projects.
Okay.
So solar financing was one of the themes that we chose. Then we thought, why not education? Why not supporting livelihood? So the idea was to see that we keep supporting all of it because the assumption is that people would donate to all the causes.
Right.
Where the audience give us the direction was the overwhelming urge for people to help each other when it comes to medical emergencies. And probably that is true for Milaap, which is individuals as the main donor base. I think the biggest satisfaction comes from saving a life.
Right.
That's where psychologically, I think across the world, when it comes to crowdfunding from individuals, you can see that, the healthcare affordability challenges or trying to help each other in medical emergencies within the social network, sometimes even outside the social network, is one of the primary drivers.
Wow.
Right? So, yes, whatever you mentioned, everything was a part of the plan.
Okay.
The audience then decided, well, no, you are going to solve overwhelmingly for healthcare emergencies. And we said, okay, wherever the audience takes us, wherever the audience finds a value and utility in whatever we have to offer, we will walk that path.
But I think Milaap came into limelight during pandemic time the most, right? I remember there was one fundraiser that was promoted by you guys. It was for the Mauli organization, which is in Ahmednagar. They do immense amount of work. The mentally ill women who have been left on the roads by the family, they were reviving their lives and very heartbreaking stories that you could hear from them. So they were like my podcast guest because of Milaap.
Wow.
Milaap actually,
Thank you very much on behalf of the entire team for telling this story.
So Milaap promoted that campaign and they wanted to build ICU and they were raising funds for the ICU and looking at the type of cases they would solve, the doctor couple. It was heart touching. And I think all of us from United States, we actually poured down to that fund, I remember. And that's where I got to know about Milaap. Otherwise, I had no clue about Milaap. In 2012, actually, we did one crowdfunding overnight for one of the health case in one of our network for one of the father. And it was overnight, we had raised about 60,000 rupees in India then.
Great.
And by then, actually, such platforms we were not aware. It was just within one corporate we raised that much of amount. And when these things came, that time we realized the value of Milaap to be there in the Indian society, especially.
Thank you very much again. Yeah, I mean, as you mentioned, during the pandemic, we did see two major waves of crowdfunding. Now, while healthcare emergencies are major part of what we do on a daily basis, disaster relief has always been an integral component. It started with, I remember, I think you will also remember, 2015, there were devastating floods in Chennai. So that was our first real experience in terms of how people would use a crowdfunding platform during disaster relief, and we saw all kinds of initiatives. I mean, we unfortunately could not support the 2013 Uttarakhand floods. And it's interesting, 2013 Uttarakhand floods, a lot of people came to us by saying, would you support flood relief? For various reasons, we didn't have the entire verifications, and our donations model and everything was not yet ready. We were still more focused on microfinance.
Oh, okay.
We unfortunately had to say no. But that was actually a trigger point for us to start thinking. Do we expand the scope of Milaap beyond grassroots, beyond microfinance, and let people think and come and fundraise for whatever they would like to do?
Yeah.
So taking a cue from there, when COVID came in, 2020, the first wave in India was a major livelihood crisis.
Yeah.
Because seeing the global trends, there was a decision taken for a lockdown, which had to be stringent because we didn't know what we are dealing with, right? And that lockdown created a lot of challenges for people across the segment in terms of livelihoods. So we did massive campaigns to help drivers with a ride-sharing platform. We did work with Uber. We worked with Swiggy, which is one of India's top food delivery platforms, where they were using their restaurant kitchen network to provide food relief. So that way, a lot of organizations in 2020 came together for livelihood support. The same thing, if you fast forward in 2021, which was the second wave and was probably a devastating health crisis, because that's when we kind of had to see the maximum number of mortalities in terms of the COVID scenario. That's when we saw a lot of fundraising for healthcare.
Wow.
You would remember the oxygen cylinders and the oxygen crisis.
That was one of the biggest crises, right?
Yeah. So we had a lot of organizations, big and small, right from Cred, which is one of the top fintech companies in the country, all the way to smaller organizations working at the district level, trying to solve the oxygen cylinder crisis. People had to fundraise for the families of their loved ones who had passed away. So we did see those two major waves in terms of fundraising. And yeah, we are happy that, at that time of a crisis, people found utility and value in what we build.
So Mayukh, what are some of the important verification processes that, Milaap takes care of? Like as a donor in United States, if I'm, contributing towards some India causes and that are like, that requires some of the important verifications. First of all, as a donor, how I make sure that the Milaap protects my data. And second of all, how do I ensure that the funds that have been raised is for the valid cause going to the right beneficiary and there are no other fraudulent activities that would happen? So what are some of the important measures that Milaap takes in general?
Look, if you are talking of today's world where mobile payments are commonplace, and even more so back in India, everybody has a Google Pay. In India, Phone Pay or Paytm is really popular. People can just send money to each other. And we keep asking ourselves the question, what is the value that Milaap provides, or what is the utility that we have in the ecosystem? If you were to ask me that question, I would say trust and verifications is the single most important reason. Right? Because at the end of the day, we survive. The platform exists because donors trust. There is no other second thought to it. Now, how do we go about trust and verifications? I'll give you the example from the perspective of healthcare, because that is the most common utility that we or that our users find on the platform. Now, when it comes to healthcare, and we see that a fundraiser has been set up or requested for a certain patient, we try to verify three things. Firstly, does the person in whose name the fundraiser has been set up is a real person or not. Second, does that person have the condition or the ailment, or does he require the treatment that is being written or being asked for? And the third is, do the costs come within the same ballpark of what the fundraiser is seeking to raise? Right? How do we go about it? On the first case, in terms of verifying a person, we apply the entire framework that financial institutions across India apply. When it comes to verifying the ailment, the treatment, and the cost, it's done through a combination of technology and talent, and also data, which we have been able to gather over 150,000 fundraisers over all these years, as well as a network of hospitals. So we probably are connected with over 90% of the tertiary care hospitals in India.
Wow.
So if a cancer patient is coming in and there's a fundraiser required, we are just a phone call away from any hospital in order to do the verifications, the basic groundwork of it. So that's an extremely careful, elaborate process taken at multiple steps throughout the life cycle of the fundraiser, where we try to verify that we are putting the money for the right cause. In case, now every trust and verifications framework, we have to be aware also that it cannot be 100%.
Yeah.
There will be one-off cases where sometimes the systems do not detect, or sometimes something has slipped through. At that point of time, we have a full recourse process where there are times when we have gone ahead and refunded the donors.
Wow.
Right? We have gone ahead and sought legal recourse in terms of trying to go and figure out, and work with the local authorities to hold people accountable. Right? So again, everything is done from the perspective that when donors are donating, at the back of their head, they have the assurance, even if it's a 0.1% chance of things going wrong, I have someone to get back to. Milaap will stand for me. And that's the principle we apply, and those are some of the basic steps. In terms of data, the other question that you asked, we take extremely careful measures, like when it comes to email IDs and phone numbers. Specifically when it comes to phone numbers, we have a policy that Milaap will never call a donor.
Okay.
And it's on paper. It's a communication that's sent out to people. Right? We do not believe in calling and disturbing people to solicit donations. I believe it's the organic social network through which people come to know about fundraisers, and that's how it's done. Not even our team is allowed to see phone numbers.
That's wonderful. So how the data is, is it like the credit card data and everything is encrypted and it is being stored at a very safe and a secure way? That is another question that I would ask.
Yes. So we follow most of the kind of cutting edge protocols. So when it comes to US audience, we work with Stripe, which is one of the leading payment gateways, which has all the checks and balances in place. We put our own systems on top of it to ensure that the frauds or credit card frauds are brought down to a near zero. So we have learned over the last 10 years, and touch wood, but yeah, I'm happy to say that we rarely see those fraudulent transactions. We try not to store card information ourselves because that's something we don't keep at our end and own it. Because when it comes to donations, people do it as and when they see somebody's requiring, somebody has a need. So they will come and do it themselves, and there are a host of ways by which they can do it. So we prefer not to keep those information at our end.
Oh, wonderful. So, looking at the Milaap platform, how it has evolved, with that, you must have seen a lot of country paradigm shifting in terms of governance and all as well, right? Because initially the Aadhaar cards were mandatory, but by the time Milaap came or, was born, but I don't think the entire country had been gone through that identification process. So that was one of the challenging period you must have seen. And then later on, I think a lot of governance is in place, so it become more easy. So, in terms of, if I have to say as a third party technical portal, when you are looking how your country is progressing, all over, and how it is benefiting for you to make things easy. What is your take on it? I mean, it's one of the fancy stuff that we see in India now. You just have to walk out with the phone and you're just,
Yeah, I think we have made tremendous progress in terms of financial inclusion. So we need Milaap. See, Milaap will need two things at a very basic level. People with bank accounts, because we do not deal with cash. So most important aspect, which we made a decision 12 years back, that we will not deal with cash in any form whatsoever. So it requires financial inclusion in the sense that both the donor and the recipient should have bank accounts. The second is availability of internet. And if you look at these two paradigms, India has gone through a massive shift and really a tremendous progress, during this period in terms of getting people to have bank accounts and getting internet out there, which is powering the entire mobile payment ecosystem and everything. So definitely we are built on top of that. Right? So we have benefited. I mean, in many ways, you can say that the phenomena of crowdfunding is an antecedent to all of these things that are going to happen. When you have internet and when you have bank accounts, we are just providing another way for people to interact with each other.
So as you said, like donor driven your, platform to evolve further and further. Similarly, Milaap also collects a lot of needs, and when it came down to verification systems in a lot of other segments, finance being the primary, and then other verification causes, now that you have paired up with the hospitals, but there are many other causes, probably they didn't have any governance in place. Does Milaap drive their processes to be more, solid or soundproof?
To an extent, we try to. I would not say that with every organization we can drive it, but say our verifications is also progressive in the manner that the more an organization or a fundraiser raises, the more stringent the checks and balances are going to be. So we do have systems in place. Say, for example, when organizations are fundraising and they are fundraising beyond certain cutoffs, there are limits that have been set. They are adapted by the team. We do ask for further documents. We'll ask for audit statements. We'll ask for auditor-specific reports. We'll ask for their submissions of some of these things we ask, and we are very stringent about in terms of some of the paperwork, like organizations which can raise money from overseas.
Right.
Like absolutely by the book when it comes to those laws. We need everything in place. Some of the things we kind of see how much the fundraiser is progressing, how much they're raising, and accordingly put the checks and balances in place. So it's dynamic. The best thing and probably the trickiest thing of trust and verifications is it's never, I've set the rules today and they're going to be the same year after year. It is evolving, and that's why we say it's central to our thought process. To always continuously evolve, continuously bring in new technology, talent, network. Those three things are equally important.
Has there any incident, say particular, like, some of the organizations have certain rules laid out, and then on top of it, you went and gave some inputs that, hey, looks like this is a little fishy verification, or, there are sides that we really need to, there are corner cases that need to be looked upon. And have you helped somebody improvise on that?
It's, again, as I mentioned, verifications is an evolving process. We learn with every new fundraiser in terms of it. And we have seen organizations evolve along with us. Like we have seen animal shelters which started in the really early days. I cannot recollect the exact names, done for quite a few of animal shelters, who's just started as somebody wanted to do something for stray animals. And as they started raising, we have had people who have come in and said, you have worked with so many organizations. Please tell us how exactly we put the framework in place. Right? What are the checks and balances that we should have? Because at the end of the day, the donors who are donating via Milaap are also technically donors of the organization.
Right.
They become the biggest evangelists. The donor network of Milaap eventually also becomes a big volunteer network for those organizations. Right? So it's in mutual interest of Milaap as well as an organization who is fundraising using Milaap as a platform. At the end of the day, we are a platform. We are more of a tool at the hands of people.
Right.
And our work is to ensure, I could call it as sanctity of the marketplace, or ensuring that the tool is used in the right way. That's
Right.
the primary way we look at it. So yes, to answer your question, very simply is that people have come and asked help in terms of when they are starting off new, specifically when it is about organizations which are working on various areas, and because they believe that it's in mutual interest. Eventually, the trust and verification framework is something that benefits everyone. It increases the donor trust. It increases the number of people who will donate. It increases the amount that people want to donate. So yeah,
so extension to that question probably about the payments, right? When you're collecting from different countries overseas, there is a deduction that will happen.
Sure.
And you make sure that the donor is aware about it, right?
Yes. So in terms of, look, we are free as a platform, and we depend on only voluntary donations by our users for running the operations of Milaap. When it comes to the standard deductions, a payment processing gateway, which is Stripe, say for example, in the USA, and for people donors across the world, or we work with Razorpay, which is one of the largest payment gateways in India.
Right.
There are deductions and there are standard deductions. So those deductions, the person who is fundraising is already aware of.
Okay.
Right. So whenever somebody is setting up a fundraiser, and you can go and visit Milaap's website, you can actually see how much you will receive if you were to, raise a certain amount of money based on the proportion of Indian and overseas donations, because there are differences in terms of the pricing, in terms of how much the payment gateways charge. So donors do not face any charges.
Okay.
The charges are borne by the person who is fundraising as third-party charges. Exactly the cost that we see as a platform for that particular payment gateway is the cost that we kind of pass on to the fundraiser, the campaign organizer.
But then does the donor gets to be aware when they are donating? Is there a transparency in that line?
Yes, there is absolute transparency, and as I mentioned, anybody on Milaap website can go and see what the deductions for payment gateways will be. It comes to an average of somewhere around, I think, 2% of the funds raised. That will go as a direct.
So Mayukh, I have a very interesting question coming up when it comes down to Milaap, which was for-profit platform as it established in the beginning. It used to charge platform fees, and I think the COVID-19 drove the fact that it will be, there won't be any platform fee charged to donors. So how really Milaap is, standing tall, how it is feeding approx 90 to 100 employees, staff, and how your investors are really looking at Milaap now. Because as an investor, I would be very interested in my ROI for the company or the startup that I invest in my portfolio. So how it is, working out so far?
Let me take you back to 2020 when we took that decision. So as on principle, we have never charged money for, even when we were having a fees driven model, we used to waive off our fees for disaster relief.
Okay.
Right. Whether it was Chennai floods back in 2015, and then there were subsequent few other disasters where we've always waived off the fees. Now, 2020 first wave of COVID. Now, COVID is a disaster relief. We have waived off our fees, and that's the only thing that we are doing.
Okay.
So we actually had donors who come write to us who said, I see you guys running fundraisers on COVID day in and day out. I believe your staff's 100% time is going in this only. How are you guys sustaining when you are saying that, you are not charging any fees? You know what? For the good work that you are doing, may I do a contribution not to anybody else but to Milaap directly?
Okay.
Right, so when that phenomena happened, I mean, and it's with just a few donors we saw that, gave us the kind of thought that maybe we could give it a try.
Okay, so till then you had not established a voluntary tipping model?
No, till then I was on a fees model.
Okay.
I still remember the date, 14th August 2020, on the eve of Independence Day, we decided as a team that we are going to move away from the 5% fees model. We are going to move to a tipping model. I mean, GoFundMe had been practicing that in the US for a while. So we know in the US it was working, but it was a whole together different bet to take, saying that would Indian audience tip?
Right.
Well, for some reasons, we got the team in alignment. I gave them the assurance that we have money in bank to take this risk. The investors came on board. We thought that this will be a 3 to 4 months experiment because in COVID, we were also trying to do various things, and this was just like, let's try it and see how it works. And as I mentioned, thanks to users, thanks to people like you, the 3 months experiment has gone on for 4 years.
Wow.
And here I am. And here we are. So yes, it's completely on voluntary tipping model that we depend on. And I think that we are really happy that we took that decision.
Okay.
Because what it gives us is that it gives us a daily validation. At the end of every day, I get a validation that I'm providing some value to people.
Wow.
If I'm not doing customer service the right way, my tipping rates are going to show it. So customer service is no longer a new metric or a new dashboard. We don't have to use anything of that sort. For me, my revenues and the fact that we sustain as a platform is a proof that we are able to do customer service, and we have seen it.
Wow.
The best part is where it's not that we have always been perfect. Wherever we have slipped, we have seen that dip. So we know people react. and we are grateful to that.
So do you think now it's time for Milaap to move into non-profit sector?
So we already do. So Milaap is, as I mentioned, Milaap as a platform is open to all forms of causes, so long as we can verify it's genuine. Healthcare is predominantly the cause that you see because people donate there. People find the maximum utility there. Now, that said, we are still connected with over 12,000, I think, not-for-profits in the country who would have fundraised on Milaap at some point of time or the other. Because at the end of the day, the donor trust and the fact that we are trying to put the right checks and balances as well as making it easy for everyone, that resonates with all the other platforms.
Okay.
And what we see is as donation behavior becomes more evolved, people do deeper thinking around how they donate. We will see an increase. It will be gradual, but we'll definitely see a gradual increase in the number of fundraisers on other causes. Like, the number of animal shelters that we see fundraising for is definitely an indicator.
Wow.
10 years back, it would have been one animal shelter fundraiser a year. These days, it would be like 3 to 4 or maybe even more. Right? And I think it will grow significantly as more and more people connect. They understand that that's a cause that they would like to support, and organically it starts building up.
So when it came down to, Milaap fundraising, there are a lot of innovative structure you have put down. I see you raise the events in corporate segments for the Milaap, not directly for the donation, but kind of awareness, and there are CSR programs that you run. And there is also a different model of promotion that you have it in place, which is also kind of, help reach a particular fundraiser to the massive audience. And there are a lot of efforts actually for the digital promotion that goes behind, and, Milaap comes forward. So would you like to elaborate on those two things?
So in terms of the events that we do, a lot of it is done at the hospitals as well, trying to work with, because we work with a lot of children suffering from, life-threatening ailments. So we do work with organizations in trying to support them in trying to, and at times that extends to the corporates who may be willing to host such events. When it comes to promotion, it's an interesting reason why we kind of do promotions, and it is usually when a person has either ran out of their social network and still needs money, or it's a situation from a person where the person doesn't have a social network. Like, what do they do at that point of time? Because organically within the social network, which is the typical way crowdfunding is done, money will not be raised.
Right.
At that point of time, for a limited set, and that's like we have to limit it because there is only so much that we can do. We try to put these as promotions on various digital platforms so that a wider audience can get connected and can donate. At the back of, again, the fact that it's hosted on Milaap, so it can be trusted.
Right.
But again, the care has to be taken in that entire thing is the balance of not doing it to a point where donors feel they are being pushed. right? The balance is the trickiest balance for us,
Yeah.
to which I do not have the right answer today. And that's an answer we try to figure out every day as we work as a team, is to ensure that the maximum amount of money is raised.
So Mayukh, the fact that you are in US today is to, and also I see there is a Milaap entity that is set up in United States. So first of all, why only this country being your second overseas expansion? And the second thing is, right now we see it is a non-profit. So as a donor, I see huge benefit by donating to Milaap for the causes that I resonate, especially being an immigrant from India, which makes it even more, what should I say? It is an emotional connect that you bring together for us. So I'd like to know why United States is your second most destination that you chose versus you worked in Dubai, your partner was in Singapore. So you had access to rest of the countries with a very known facts, right? So what is it that driving Milaap?
Again, thanks to the generosity of donors and probably 300,000 donors like you who have been organically connected with Milaap from the United States. Look, we receive donations from 130 countries. Right, our entity in the US and our presence has been there for almost 10 years now. So US has been the base for us to collect donations from across the world and then send to India. So that way we have been here. The ecosystem has organically evolved to, as I mentioned, over 300,000 donors, probably knocking on the doors of a
300,000. That's a lot. Yeah.
Yes. And again, as I mentioned, it's all organic. It's not that we have gone ahead. Interestingly, think 20 to 30% of them are donating on a regular and a repeated basis. So that's
you have a good recurring donors base.
Yeah, it's amazing to see the generosity and also the trust of people. So we are grateful for that. What has happened over a period of time in terms of our evolution, we were able to set up even an associated not-for-profit entity in the US, which gives us the flexibility to expand the ways by which people in US can donate on Milaap. So 5 years back, it was about swiping your card. We have that system since the time we have existed.
Right.
Today, you can as seamlessly donate from your donor advised funds. It's a seamless integration that we have done at the back end. We will take care of the administrative work. You can donate on Milaap, and you can just, by typing your company, prompt the company to match that donation, which will double your impact. So, which is a big thing in the United States. We now have access to those forms. So yeah, it's a combination of the way the donor base has evolved, the trust that we have gained and we are blessed to have, along with the various mechanisms and the various ways of enabling donors in the United States to help causes and people back home. That we think this is a time for us to start at least understanding the donor base, in a deeper way. And that's what brings me here to try and start communications, start talking to the donor base, understanding what they need, and how can we evolve together for the next phase and journey of Milaap.
So as an entrepreneur, it's a very interesting segment to look at how Milaap has evolved. First of all, you have a continuous data feedback loop that goes on and you're retrospecting it very heavily in order to decide your next moves. So as an entrepreneur, I think you're doing phenomenal job, right from extending, having that vision, and then achieving it. Execution is the most hard part. A lot of people can plan in their own minds, but execution become a very tough part. And right here, one of the audience has poured the surprise question. I have picked the one that kind of is relevant to you. And the question is, as a startup founder, especially being in the social impact segment, where there is not a consistency of ROI that can be defined, what are some of the important struggle as an entrepreneur one has to overcome?
Best way to look at is take a step back and focus on the problem and focus on the other important question: if we are the right team to build it, if this is the problem that we should be solving, and just go about solving it. If it's anything related to India, if somebody sitting in India is solving a remittance problem, it has a tremendous social impact.
Right.
because there are a lot of people who find, and of course, remittance has been solved to an extent, but
Hmm.
a lot of people who still struggle with it.
Right. But the question remains here is it comes down to a social impact, right? There are a lot of struggles to exist. There are a lot of startups that build it with the model of exit. 10 years down the line, I'm going to have an exit. This is my benefit that it looks to. And this is also another segment when it comes down to segment, which a startup segment that is majorly being focused, especially in United States. A lot of startups are built with a mind of acquisition, with the mind of merger, and then having the good exit a decade down the line. Whereas these kind of impacts that we're talking, that you have to, run through a lot. It's a lifelong journey. So that's the difference, I believe. Probably the audience who was questioning was, having this idea in mind.
Again, I think fundamentally, it's not my words. I've heard it from someone who said, businesses are bought. They're not, good businesses are bought. They're not sold. So if a problem is solved and value is created, the exit or the other things, they are a consequence of building the right business. Right now, when it comes to social startups, yes, one of the things that people have to be aware of, and it's good to be aware of, is that the time horizon is probably going to be longer. But other than that, the principles probably remain the same.
Got it.
In a social space, it's unlikely that you will see somebody doing a hyperscale and immediately exiting a business in 5 years. So which is where I think it's better to look at the problem from the perspective of building a business that exists 10 years down the line. Yes, I do agree that in terms of the timelines that you think about it, it's better to think on a stretched timelines.
There are a couple of more questions that I have in terms
Sure.
of the Milaap. One is, looking at how you have structured Milaap. It's with a very intentional way. There is a good gender equality that exists. The gender pay ratio is down. In fact, the women's get 1.5% paid more. There are 65% of women in the leadership, 38% being in the tech. So how did you exactly achieve this portfolio of employee base? This is, everybody strives for it, but unfortunately, when it comes down to startups, or in your case, it's a voluntary based model, it's very hard to digest that, work with that kind of a funda. Rather, I would pick a student intern and have my job done at a lower cost versus thinking about all these factors that ideal company should have it. So how did you make it achieve?
In terms of leadership, I think if you were to look at people who are really running the business, today it will be 100%. VP of Tech, who has been with us, one of the best tech talents I've ever worked with, has been with us for 13 years, Sumisha Chandrasekharan.
Wow.
Manya Sharma, she has been with us for 8 years from the time she graduated out of college, seen the entire company, practically runs the business as VP of BizOps. And then we have Usha, who has been with us in finance, and then Chayanti, who is, again, we have known her for like 8-9 years, who heads our communications. So yeah, people running the company, it's 100%. But to answer your question, what? I think the only thing we did was whenever we saw that there is a talent required in the team, we just picked the best person who was willing to work with us, and organically it has just evolved. Yes, we do know in certain areas we figured out that, and specifically in tech, one of the times when we took a conscious call was we figured out that mothers who are returning to work, who needed a certain amount of flexibility, and who kind of wanted to fit their day in a certain way, they were extremely valuable to us. Wow. At the phase of the company that we were working in. They brought in a sense of, and we love the fact that they brought in a sense of discipline in the team, because they cannot
they'll be running under the
unlike
clock.
The kids in their 20s, they will not be able to stretch their timelines in the evening. So things became efficient. So there are sporadic areas where we have taken a conscious call. But other than that, to be honest, we have always tried to pick the best talent who is willing to work with us.
Okay.
And people have just evolved in the roles and they have grown. And what you see today is just probably our best effort to appreciate and nurture and give opportunities to the talent pool we could get in touch with. it has been that much. I mean,
So there were not intentional efforts put as such, like saying that now if there any position gets open, it is theoretically for looking at the gender biased ratio. It's not like that. Like many US companies, generally they do have certain things like that, and they would mention it even that we prefer onboarding women for this position, or we prefer let's say non-binary person for this particular position. So it's not
So,
like that.
as I mentioned, in certain instances, specific instances, we may have. Sometimes we may want in our customer support to have a balance, because some people are more comfortable, and you're talking with people who are facing medical emergencies.
Right.
So having a wide spectrum, people who know all the languages, people who understand, who have different levels of empathy is important. So yes, in specific roles, in certain scenarios, based on the kind of support that our users need, we might have taken those steps. But in general, I think it's a massive talent pool of women out there, and I cannot speak of other companies. That's not something I actively study as well. But given our experience, it has been fairly simple in terms of just grooming the right talent and working with people who have the right intent, who are here, because of course they want to build a career for themselves, but also have their empathy in place, are disciplined enough, resonate with our core values. And yeah, we've just gone about it, and things have built in organically.
Okay.
And maybe I'm lucky enough in the fact that they have imbibed the same values as we wanted to start the company with, and gone ahead in terms of building their own teams that way. That's how it has.
So do you think women have shaped a huge discipline in Milaap, how it is operating in terms of, and in fact the customer service? I think you need to have a very strong empathetical driven customer service staff to be trained, because those phone calls cannot be coded. You cannot have some auto machines to run it. It has to be a direct person, because looking at the causes that you're driving, it has to be actual person who needs to pick up the call and answer it in a right way. So what is your take on it? Like how your training had shaped up, and how women's have made it more disciplined or impactful?
Great. So again, taking one step back here, empathy is one of the core values on which we are built, right? And that's essential. Otherwise, you cannot go about running something like Milaap. And when you're talking of empathy, I think there's definitely an advantage of having a healthy gender mix in the team, because we all have different levels of empathy. Let's understand that.
Yeah.
And the users who are coming in, I mean, if you were to understand the mindset of the user is giving me and the team an opportunity to work with them or walk with them in the worst crisis of their lives.
Right.
Whom do you get to when you have a worst crisis? You get to their closest, nearest friend. Right? You don't talk to a stranger and say, I'm facing a crisis. So we are given that status of being the dearest friend to walk at that time. Right? So we definitely have to be careful about that empathy angle. We need to have a team which is working on the entire spectrum. Right? Some people want to come in and say, I don't want to talk too much about what's happening with me. I need to fundraise. Just help me fundraise. I know the audience who will support me. And you just do a functional work. Great. You need to have someone who is resonating with it. The team keeps transferring, saying, I think you are better equipped to do it this way. Some people want to talk more. Some people want to share more because they don't have anyone to share.
Right.
And this becomes an avenue for them to at least share some of the things where their fundraiser may be successful, their fundraiser may be partially successful, but it's also important that we listen to them.
Yeah.
So you need a very different kind of personality to be able to resonate with that customer. The crossover may not always work. So we try to optimize. It's not that it's not science. It's more of balancing it out. The team has to balance it out. So which is where I think the gender mix makes it an amazing thing. Because in terms of empathy levels, in terms of understanding, like a lot of times when we are fundraising for neonatal cases, Women who have been mother themselves, they understand what that family is going through.
Right.
Right. So you resonate with situations of people. There are a lot of times, again, it's not just about gender balance. We also try to strike a balance between people who are at a certain age group, people who have children, because there is a lot of fundraisers for children suffering from cancer.
Right.
Right. And that's the worst thing for a parent to see. I mean, I really
it's
cannot
heartbreaking.
comprehend that way, what they go through it. So at that point of time, if you're able to get them to interact with somebody who has a child, the resonance is a lot higher. It's not that, I have 20-year-olds who have graduated out of college, and the fundraisers, the campaign organizers, the family just has praises for them.
Wow.
But we do try to understand that we try to resonate our audience,
right,
and what they may be looking for when we try to build the team that we work with.
Oh, wonderful.
And
so
that's
accordingly, you will put your customer
we
service.
try to strike a balance. Again, as I said,
yeah.
I don't have a map to it. It is not
Yeah.
science. It's a continuous rebalancing work. It's a continuous understanding the audience. So, but that's an intent. From an intent perspective, that's what the team also strives to do. Today's leadership, who is running the company practically, is doing that as well.
So, as an entrepreneur, how much time do you take to reevaluate and hit the rebalance? Because you're very busy, right? There is not just Milaap entity in India. Now it is in US with the non-profit. You're running behind so much portal integrations and a lot of nuances that goes beneath. Now, a new company that you're establishing, which is a wonderful initiative, especially for the United States people, GetCoPayHelp. Then how are you striking this balance?
I only question today, what is the next big jump, or where could things go really off? So that's the only thing I have to do, thankfully, because of the team that has taken over. So when it comes to the nuances that you have mentioned, when it comes to running the entire platform and figuring out what's how do we kind of keep building on it, the team has completely taken that over. So, and that has been something that Anuj and I have built over the last couple of years. Right. Today, what my role is, for example, we want to take a leap, and we want to take a leap of faith with our audience in the United States. 300,000 donors, last 10 years. Probably we can make Milaap the gateway to India in terms of whenever somebody out here, whether it's an Indian diaspora or somebody, there are a lot of people who have been born and brought up in the US, and they just connect to India at a different level. Probably more than even I do. Right?
Yeah.
For that kind of an audience, we want to be the gateway of India in the next 10 years. So those are the kind of leaps and evangelism that I try to do. And of course, the other side of things is trying to ask the question, are we going wrong anywhere? Because that's something that you have to constantly ask. Right? Only the paranoid survive.
So Mayukh, after Milaap being in United States non-profit entity, there is another next project that you are involved with. It's another startup, GetCoPayHelp, as you rightly said. It's very essential, by the way. Although United States, everybody has health insurance, but there are a lot of causes that doesn't covered by insurance, and there have been many fundraisers on that, personally witnessed on GoFundMe and many other platforms.
Correct.
So what do you mean by GetCoPayHelp, and how it's going to help all the users?
Great. So GetCoPayHelp is a platform for people right now, for people in the United States, where we try to figure out various sources of help for those who are struggling with their copays on high cost medications. So now what has happened in the last 10 years is that you see a huge segment of high cost medications in the market today. To the extent that a surprising stat is 2% of the prescriptions actually account for 51% of the medication bill in the United States. Now, even if you have insurance, when it comes to say $100,000 drug, right, the insurance might cover on a ballpark, say $80,000. $20,000 is not going to be an easy sum to pay for someone who is already suffering from a chronic or a complex ailment.
Yeah.
Right. What we have seen, and given the ecosystem in the United States, there are a lot of help available. There are funds available at an institutional level. whether it is from the manufacturers, whether it is from the foundations, and there are certain government programs, I believe, which are coming in and shaping up. The challenge is, how do you figure out a way to make it seamless so that people who need the help are able to access it?
Right.
And it's not about uninsured. Uninsured is one segment. It's about people who are insured across board, whether it is through their employer, whether it is through private insurance, or whether it is through government insurance. Right. So that's what we are trying to build in GetCoPayHelp. Work with patient advocates, work with specialty practices, doctors, work with infusion centers to see how we can make it easy and seamless for their patients, and also patients directly with various foundations, to see how we can make it easy for them to access aid.
Okay.
So that's the thesis of
So it's gonna be like a direct integration between a patient and a healthcare provider. I mean, that is the gap that we're looking to bridge. Or
The gap
it's
we are trying to solve is, let's say a patient has a certain cancer, or a rheumatology patient has been prescribed a certain high cost medication and is struggling to find help around co-pays. What we try to do is, based on certain criteria, based on some of the proprietary engines that we have built in, we try to figure out what all avenues of aid are possible. Right? It could be as simple as getting a copay card, which you can download. I think a lot of insured patients have done. Then it could be about patient application, the PAP programs, patient assistance programs that are there. Challenge with all this is, it's heavily cumbersome for a patient to do all of these themselves.
Right.
Or if a doctor's practice or an infusion center is doing it on your behalf, it's a huge administrative cost on their side.
Okay, that has to be paid by patient?
It is being paid in various ways. Either the practice is taking the bill, or the patient has to pay for it. Right?
Okay.
The administrative work, you have to fill out PDF forms. The forms may ask the same information, but they may be asking in various different formats. Right? And doctor's time or the practice time is invaluable.
Right.
Patients are already having a challenge with managing a complex situation. Like we have started working with neurology patients who are working with suffering from migraines. Now, a migraine patient to fill out forms is practically an impossible task, and
right.
It's difficult for them. So what we are trying to build here is something that can ease out that entire process.
Cool. So it's very interesting, actually, the problem that you're looking to solve, and especially coming from India, looking to solve the United Nations geography problems that exist, and probably staying in Silicon Valley, where there are a lot of startups are every now and then busting. I am very fascinated to see, how did you exactly cover this particular niche? I mean, healthcare being understood, because through Milaap you have enough data to gather, but going to this niche and coming out from different country, doing this study R&D for exact problem, it's what really triggered you?
That's an interesting question, and I understand where you're coming from. So GetCoPayHelp, I can say, is a synthesis of Anuj and my 10 years of work interacting with 150,000 patients. Because if you look at it fundamentally, all we have done is try to solve for affordability gap in healthcare. When it came to crowdfunding, people are not able to afford a treatment. People are not able to afford cost of medicines when it comes to cancer. They're not able to afford the cost of a hospital stay for an ICU, the neonatal ICU, as I mentioned, and trauma cases where a person has gone into coma.
Right.
What crowdfunding is doing it is using a certain source of money, which is money from the crowd, and trying to solve that challenge of healthcare affordability. Right? Fast forward for us doing it 10 years and Anuj thinking that, what next to do. Patient engagement and healthcare affordability, health equity is the only thing that we have done in our decade, or practically for a lifetime. So we wanted, and we realized one thing is that this is a global problem. The affordability gaps, and because of which there is a difference in health equity, is existing across the world in whichever way the systems are financed. Right? So then our question was, okay, we've built something in India. It was a great experience. It was a great journey. Can we look at something at a global scale at the next step? And one thing leading to the other, as we have also seen on Mila, is that cost of medications is one of the major reasons why affordability becomes a challenge.
Hmm.
Because if you look at, say, for example, placeholder of cancer,
Hmm.
your major expense is on
Medication and
medications, right? Surgeries will be involved in a certain smaller segment of cancer cure. The
but
major
ongoing, yeah.
treatment is all about medications. And in the global drug scenario, medication scenario, we are at a very interesting phase. In terms of medications, we probably are at a phase where, overall, from a humankind perspective, we were when antibiotics were coming in the market. Today, with gene therapy and cell therapies coming in, where we can do precision medication, we can do personalized medication, we are knocking at the doors of solving a lot of ailments which we could not have otherwise done. Like CRISPR is 2012 Nobel, so that's just 12 years, and look at the amount of gene therapies that are already in the market.
Right.
So we will be able to solve a lot of these critical ailments. Some of the cancer, I think some of the liquid cancers can already be treated. Still struggling probably with the solid tumors. But it is also posing a major question in the ecosystem, that how do we provide these treatments which are inherently expensive because
Right.
of the innovations that is required, because your audience and the pool of applicable patients is less. How do you provide all the deserving people this treatment and still not bankrupt the system? And that's
Yeah.
a burning
Yeah,
question
that has
across
happened.
healthcare.
Yeah.
So I think GetCoPayHelp is an outcome of last 10 years of what we have seen, between Anuj and me with Mila, engaging with over 150,000 patients and solving for healthcare affordability. At the foundation of both the companies, of the thought process is, how do we solve for the affordability gap in healthcare? Kind of, we have done something in India. There's been an amazing journey. We as entrepreneurs and as a team wanted to do something at a global scale, and we realized pretty much as a part of running Milaap that affordability in healthcare is a challenge across the world. In any system, whether it is government finance, whether it is finance mostly by insurance, or whichever, or it is the out-of-pocket system that India has today, it is a universal problem, and cost of medications is one of the major drivers of it. Even more interesting it becomes when you see that when it comes to medications or healthcare, we probably are maybe at a similar cusp of innovation as we saw during the time when antibiotics were coming in the market 120 years back. Now you have gene therapies coming in, you have cell therapies coming in. We are knocking on the doors of solving a lot of the otherwise untreatable situations.
Right.
I mean, I'm extremely hopeful that in a few years we will be able to say certain forms of cancer, we have brought it down to the point of a long-term chronic disorder. It's no longer life-threatening. It's no longer like, you have cancer and your time is limited. The challenge that it brings up is, how do we provide these therapies which are inherently costly,
Right,
and not bankrupt the system? That's a burning question. If you across healthcare across the world, in United States it's profound, because United States happens to be the biggest market for medications globally, and I think that's a fascinating problem to be in. Right?
Yeah.
And it will require pulling strings in a lot of ways, figuring out sources of money, engaging patients. Medication non-adherence costs, I think, the United States about $300 billion in healthcare costs every year, with your emergency rooms and all of it. So how do you improve on adherence so that the overall cost comes down? People are not able to adhere because they're not able to pay their co-pays. 67% of the patients in US suffer or struggle to pay for their medications. So it's all interconnected. It's a jigsaw puzzle which has to be completely rewired. And in the next decade, we will see that happening. And it's super exciting for us. Because we've seen that.
I can see that. It is an exciting problem to solve, important problem to solve, and a very exciting space to work.
Absolutely. The pace of innovations. Right? Today in the United States, 2% of the prescriptions are causing 51% cost of medications. Wow. So that's how fast the high cost medications are coming in. We need them. We need them to treat diseases. Some of the rare diseases are becoming treatable now, which otherwise children having rare diseases, you would have just said There's no other way, and we are able to treat those. Now the question will come in. It's a huge question to be solved is how do we ensure that it can reach to the people who need it? So health equity, healthcare affordability are big questions across the world. And one thing about healthcare is you solve it anywhere, you have solved it probably for the entire world. The solutions that are coming today in the US, the drugs that are coming today in the US are going to be there tomorrow in India. And already the cross-pollination is so fast today that some of these therapies are already kind of emerging and people are researching it in India. So some of the mechanisms we build here in order to solve it, it has learnings across board. So
I think you're solving very interesting problem. And
it's just fascinating the pace at which things are happening. And of course, sometimes gets overwhelming in terms of the magnitude of problem that you're talking about.
Right.
But I think, that's what we have done. We have engaged with patients. We have tried to solve for affordability. And we are really happy that even in our next journey, we can continue doing that because we love to do it.
That's the bottom line of it. Like, we love to do it, and that's where we could span further. Well, best luck for that journey. I'm looking forward to have that help available for most of the patients over here who are in need of. And I'm not sure if many of them are aware about it, but I think now, through what you have discussed, they'll go ahead and look forward.
Thanks for giving me the opportunity. Thank you very much.
So where do they have to? Which website they'll
so they
go
can
forward to?
Anybody who is facing a challenge with high cost medications and the copay associated with it, whatever be the insurance. Sometimes insurance may cover it, sometimes it may not cover it. Doesn't matter. They can just visit GetCoPayHelp, as I pronounce it. GetCoPayHelp.com. And just first do an eligibility check and just figure out in a minute in terms of what all the avenues of help are available. And after that, they can, they can reach out to us, or they can say that, I need help with the submissions as well, because I think it will be too cumbersome for us. They could get in touch with their healthcare provider or their doctor saying, I have 3 different programs that I could be eligible for. Can we give it a try? We leave it to the audience. But we have already, it's early days. We have just launched the platform. But anyone struggling with any kind of a medication can at least go and check up what all help is available to them. And then we can handhold them throughout the journey until, enrolling and figuring out that actually help comes through.
Great. We'll be putting down that in description as well, GetCoPayHelp.com. That's where you'll be visiting. So now let's move on to rapid fire segment.
Sure.
It's been a long talks.
A tough segment, is it?
No, it's I think you'll do good.
Thank you.
Looking at how you have shaped up so far. The questions are not to judge you, right? The questions are more often to understand the entrepreneur mindset that goes behind all these efforts that you're putting in.
Sure.
So one of the very common question that we ask on our podcast is, the book recommendation from our guest. So since you're in this direct social impact segment, what is that one book that you'll recommend to our audience if they're looking forward to drive social impact through their work?
If it is specific to social impact, I would highly recommend Poor Economics by Esther Duflo and Abhijit Banerjee, the duo who ended up getting Nobel Prize of late. It was a 2011 book, incredibly well written, and incredibly well written in the sense that it gives you a peek into the mindset of people you want to work with.
Okay, good. Because, these are one of the very niche books that generally people are not aware about. And I'm sure your lot of thinking must have shaped by the books and other literature, and of course how the upbringing happens. But books is one of the major impact that I see that anybody could have it.
Definitely.
If we would have not been, in this Milaap journey or, startup on the technical side to solve the problem, so what you would have been, what could have been your alternate career?
I think I would have gotten closer to finance in some form or the other. So my consulting stint involved, quantitative risk financial modeling, and in some form or the other, had this journey not happened, it very likely would have been closer to finance in some ways, consulting, banking, whichever way it is. But I think I would have drifted on that.
Okay, good that you didn't go for that. I thought that it would have been in the sports segment because, looking at you, or some art segment because you're like good skater and I was hoping for, maybe a sports career.
Oh, that's a super interesting thing. I did play water polo in college. I got introduced to surfing, but I think it was too late in my 30s. But yeah, sports, I love it in every form.
What is that one advice or, mentor suggestion that has become your, the key success factor?
I think this is a statement by Jeff Bezos, but I do not know the exact phrasing of it because it's told to me by someone I had interacted a few years back, and extremely profound, which says we cannot start from our starting point cannot be from where we think the world should be. We have to start from the way the world it is today, right? And I think that is super kind of crucial for us, specifically somebody who is trying to say, I am trying to work on a social problem, because more often than not, we tend to go towards a trajectory where we always try to compare with what should be. Because that's the reason there is an idealism for which you enter that space, right? And I think that creates a lot of friction. So, yeah, I think it's an amazing advice. Unfortunately, I cannot frame it exactly the way Mr. Bezos would have framed it.
But we got an idea, right? Basically accept what you are or what it is today, and then move from there.
And start moving from there rather than trying to draw it from what it should be. And I think that helped a lot.
What is that one belief or faith that every day you wake up with to, continue your journey and expand your journey?
Honesty and persistence will always win the long marathon. It can be losing in the short term. I mean, there can be all kinds of confusion, but that's the only way to go forward.
Oh, wonderful. Honesty and persistence. Cool. And what is that 60-second fun fact that our audience or neither your employees must have been aware about Mayukh?
Some of my closest friends would have been aware, but yeah, I do tear up whenever Real Madrid or Brazil lose a soccer game.
Oh my God.
Yeah, so that's a confession.
Okay, but it's an interesting fact. Yeah. I think all over your Facebook, you kind of keep cheering up, keep adding comments about them. Yeah.
It's football, I mean, soccer or football as we call it, is very close to heart and extremely sensitive and passionate about.
Oh, wow. I think it was wonderful to have you, but there is one advice question that for a Passionate Pulse podcast audience that we always ask is, through the entrepreneur mindset, if somebody is looking forward to, work in any, start anything as their entrepreneur journey, what is that one advice you would like to give, especially to the youngsters? Because that's when major money-making drive is also there. That's where, one can take risk, but at the same time, one has to hit the balance, looking at how they're growing up and, start the families. There are a lot of equations that get involved. So what is that one advice you have?
Two questions are crucial, which we tend to miss at times because I understand whoever wants to start something is very passionate about it, has the talent, and risk also. I think a lot of us evaluate in terms of, we understand that the responsibilities that people have. But two of the things that we kind of at times tend to overlook is one is how big a problem are we trying to solve? Because everything eventually gets calibrated based on that. There can be businesses built on problems at every scale. It's the structure of the business, is the way you want to build the business, the pace at which you want to build the business. And the second thing is trying to ask this question, am I or is my team the right team to think of solving this problem? Because I think the problem entrepreneur fit is something that, because it requires a lot of introspection, it requires a lot of rejecting out theses. There's no easy answer to it, but it's good to have these two things at the back of one's mind when one's starting. The rest, people know it. They will figure out, they're talented enough to figure out. But yeah, we have learned a lot by sometimes not thinking through these things and then at times thinking through it. So we've seen both the sides of it.
Oh, it was wonderful to have you, Mayukh, and I think a lot of good wisdom pearls that you kind of, gave it to us. Anybody's looking out to make any impact or, start their entrepreneurial journey, and also what Milaap and Go GetCoPayHelp is driving. I think these are very important problems that you're solving today. And I must say, it's hats off to you and Anuj to stay persistent on your journey and experimenting out to the extent that can build innovation in
Thank you
crowdfunding.
very much. Thanks a lot for the kind words, and
Yeah.
thank you everyone.
Yeah.
And thanks for the opportunity. Wish you all the best for Passionate Pulse. What you're doing is amazing.
Thank
Keep
you
doing
so
that.
much.
Thanks a lot.
Thank you. Yeah.